Now, when we talk about innovation in those terms, we don't just talk about invention, which is often the thing that people focus on, as important as that is. And we know the NHS has a fantastic record of invention, but we also talk about adoption and diffusion, those three elements of innovation as we go forward. And this importance of taking risks, and I'll come back to it in a while, is so critical. And my challenge at the moment for myself, my own management board, and I guess the NHS as a whole, if we can't take risks at a time when we've got a surplus of 1.7 billion, when patient satisfaction has never been higher, when public confidence in our ability to deliver change has never been higher, when can we take that risk? Very important challenge for us as we take the service forward. So that's the evidence, and that's obviously the way in we need to focus our attention. But how are we going to make that real change happen for us in the NHS? Well, there are three elements to that change: strategy, systems and processes, and mindsets. And whilst it is a bit of management jargon, there are important truths within all of that, which will help us take things forward. The first thing about strategy, I think if you look around the 10 regional strategies based on delivery change of service, I think we've got some really compelling strategies for the future. And overarching, the next stage review gives us that opportunity to bring them all together and enable them to happen. And underpinning that as part of the challenge for us in relation to the really difficult circumstances that we will find ourselves in 2 or 3 years' time. And don't forget, in the NHS we have a breathing space to think about how we're going to do this, to make our plans right. The next 2 years the NHS budget is going to grow by 11%, and then it's going to essentially be frozen. So we have got an opportunity to think about these things in a bit more detail, but nevertheless they're going to be real challenges for us. So against that strategy, how do we ensure we can improve quality and at the same time improve productivity? And there are lots of examples around where we can show, indeed most of the rest of the global economy has worked out, that it is perfectly possible to improve quality and reduce costs simultaneously. The best example I can show at the moment, and the one that's in the news, is healthcare associated infections. The National Audit Office have just reported on that, and they've shown us how you've made fantastic progress in terms of delivering lower levels of healthcare associated infections, not only saving lives and improving the conditions of individuals, preventing a whole series of conditions, but we spent about £120 million on doing it, and have probably saved in excess of £250 million before you get into what savings we got of lives and suffering. A remarkable thing, and there are lots of examples of that. High quality, the kind of thing that Aradazi showed yesterday, the number of visits that patients make to our hospitals, when we know one-stop facilities in some hospitals work fantastically well, provide a better service for patients at a lower cost. And the connection between quality and productivity is innovation. It's invention, finding new ways of doing things. It's adoption, making sure that we seek out those that are the best things to do in the circumstance and spread them across the service. And diffusion, the way in which we get information out so people know and have information and knowledge to do it. So strategy, very important, and we're in a really good place. The second bit is systems and processes, and you will hear all around about innovation, the innovation prizes, the way in which we're going to do payments through payment by results to reward innovation and quality, the academic health science centres. All of these things are systems and processes. They're not ends in themselves. They are mechanisms by which we can improve quality of services to our patients. And we are in a good place. We have, I think, broadly the right kind of systems and processes. But the real issue, the real thing that we've got to face, which is so important to take things forward, is what we have in our minds. It's the mindsets, it's the culture of the organisation. The culture is not in the right place. Traditionally has not been in the right place in the NHS to support and develop innovation and risk-taking. And we've got to start to change that. I'm starting that with my management board and people who work with me, how we can change our mindsets. Traditionally, of course, cultural change from the centre has been, we know what to do, we're in the right place, it's you lot over there that have got the wrong culture. That's not where we're starting. We're starting from us in the centre who've got it wrong. How can we support you? And we're working very hard to do that. But that culture is very deeply ingrained. I know from my own experience, I once set up a service for learning disabilities in Barnsley. A fantastic service, in my view. There wasn't a service there before, and we set it up around the individual needs of people with learning disabilities and their families. A remarkable, I think, community-based service, fantastic, and real high involvement of those people in it. Subsequently in my career, I went to work in Doncaster, and for those of you who know the geography of South Yorkshire, it's not that far away. I tried to do the same there. Tried to create the same kind of community-based service and got absolutely forced back by then the health authority and the people who ran it. Indeed, I remember very clearly at one particular health authority meeting where I was making the case for this big change, and the chairman of the health authority said to me, "You can't do it, it won't work." And anyway, nothing good ever came out of Barnsley, which I thought was a little bit unfair, but nevertheless, there was some point. No, it was unfair. But that gives you we know that from our experience. Another example, when I became the regional director in Trent, I said to all of my directors who were appointed, what I want you to do is to go off into another region and steal their best 3 ideas. Absolute resistance and reluctance. It was so difficult to get people to do that. It's just not in our DNA. It wasn't the way that we work, and we must challenge this. We must as a system, we must as a group of leaders in that system challenge ourselves, because you can see around here all of the fantastic ideas that are around. All they need is someone to pick them up and take them forward. And the third example I would give in relation to the way mindsets work, I've seen a number of PCTs where they have in their accounts, in their budgets, they have a section that says nice, guidance and drugs. Money that's put aside to deliver the things that have come out of nice. Very often, the challenge for the PCT is how can we reduce the amount of money that we spend that's in that particular budget? How can we avoid, in fact, how can we slow down the adoption of these things, not speed them up? When actually our job is to make sure that our patients get the best possible treatment as fast as they can. That is absolutely where our minds need to be, but we're not there yet, and we need to challenge ourselves, and we need to make sure we get ourselves in the right place to take that forward. I think that one of the things I think has become clear to me in all of this is that we won't just get change because we say it. We won't just because we've got the strategy or the systems and processes, it just won't necessarily work. We increasingly need to look outside of the traditional systems to make these things work. So how do you challenge all of this? Well, working closely with the independent sector, with the third sector, is a great challenge for people in the NHS. Traditionally, we have tended to be inward-looking. We can learn huge amounts in those sorts of things that I've described from the private and third sector.